disease in octogenarians has been traditionally treated with less invasive treatment, such as medical treatment only and percutaneous coronary stents, much more frequently than coronary bypass surgery, so-called CABG. Overall life expectancy has been increasing, and octogenarians have increased their longevity nowadays. Therefore, we decided to review our result over the last 3 decades with CABG in this higher risk age group. My name is Kukbin Choi, the first author of this manuscript, and I'm a clinical fellow in cardiovascular surgery at Mayo Clinic, Rochester. This report will be soon published in the Mayo Proceedings. The study is titled Coronary Artery Bypass Grafting in Octogenarians, Risks, Outcomes, and Trends in 1,283 consecutive patients. CABG is considered as the recommended treatment for severe coronary artery disease because of its overall better long-term outcomes compared with percutaneous coronary intervention with the use of stents. Especially longer-term survival and decreased need of repeat interventions are expected with CABG. Octogenarians have been considered as an age group with shorter life expectancy due to increased rate of other medical conditions and consequently higher risk for coronary bypass surgery. However, with the current increase in life expectancy, octogenarians may also benefit from CABG. Due to sparse data and lack of experience, there has been no clear guideline for decision-making in this high-risk age group, and most of them were referred to non-surgical treatment, like medical treatment only or percutaneous coronary stents. We reviewed retrospectively our data of 1,283 patients with age 80 years and more who underwent coronary bypass surgery between 1993 and 2019 at the Mayo Clinic, Rochester. So these are what we found. First, operative mortality was over 4% during the 3 decades of study period, but most of these complications, including mortality, happened in the earlier era of study period, with current mortality being low at 1.6 only in the last 3 years of study period. This means that the risk of CABG surgery in octogenarians is decreasing and currently comparable to other younger age group undergoing CABG. Also, when we looked at the long-term survival of octogenarians undergoing CABG compared with age-sex matched US general population, we could find a clear median survival benefit for octogenarians undergoing CABG. Median survival time was 7.6 years compared with 6 years only for age-sex matched octogenarians in the general US population. And this difference was highly statistically significant. The overall rate of complications from surgery, including stroke and infections, was also relatively low and comparable with younger age groups. And this may reflect on our careful preoperative evaluation, patient selection, and protocols prior to the surgery. But in the other words, CABG may be very beneficial in any age group, including in many octogenarians. So what this means in general for patients and physicians. Although CABG and octogenarians carries a modest higher procedural risk, it is feasible and may provide favorable long-term outcomes with associated increase in survival. We may need further investigation to compare outcomes between CABG and non-surgical treatment in octogenarians and need to define subgroups of patients benefiting more from surgery. I would like to thank you to all my co-authors and thank you very much for the opportunity to present this study. and I would encourage you to read the article and learn more about this important subject at the Mayo Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.